Here we are. We're back. Where's Ethan? It's 1:45, Ethan. We're on time. Now I'm waiting for you. And
I'm here.
Great. I'm excited to hear about all these startups. So Ethan, I am going to hand this over to you, but we also do have Hubert and Adam here who are going to be watching the startups, as well as Duncan and Rachna and myself. But for that, I'm going to hand it over to you.
Great. Thanks, Bambi and crew. Appreciate being able to be here today. As Bambi said, my name's Ethan Prater. I am with Alchemist Accelerator, where I'm the chair of the digital health track and also the managing director of our European fund and Europe program. I'm based in Munich, Germany, where I've lived for a couple of years now after moving from the Bay Area, and certainly has, as you might expect, given interesting perspective to sort of policy and healthcare over this past couple of years, and especially these past few months. But more importantly, for today, that we have I think 3 startups who are have super interesting technology and innovations that they've brought to the healthcare system, and have agreed to spend some time sharing what they're working on and how they approach it, and in many cases even have a kind of a nice relevance to the pandemic and some approaches relevant to COVID. So so I'll get to them in 1 second. Just another brief background on Alchemist. As Bambi mentioned earlier, we're an accelerator. We partner with Prater, and in our case, we're a venture-backed accelerator program that backs about 75 companies per year, and early stage companies typically. And we have a 6-month program that helps with sales and traction and raising money and other things required to getting the business going. And about 20% of our companies are in the category that we call digital health. So based in San Francisco and in Munich. So that's a little bit about Alchemist and about me. More interestingly though, the first startup presenting today is several of the startups today are from Alchemist, not all, but one of them today, the first one is Sempre Health. And Anurati Mathur is the co-founder and CEO of Sempre Health. And Sempre Health addresses medication affordability and adherence by better distributing essentially the dollars through the reimbursement system, and so Anurati is going to talk about what Sempre Health does and their innovation relative to healthcare and even with a little bit of policy in there. Anurati, please take it away.
All right, thanks, Ethan. And I'm probably just going to jump in and speak pretty quickly, but I think there is a Q&A session at the end. So Sempre was founded 5 years ago, and there are 3 main problems that we address. First, today, benefit designs are really sort of one size fits all. You know, often our copays are literally printed on pieces of plastic mailed to us each year. And at the same time, patients skip care because of costs. So those 2 things didn't make sense to us, that on the one hand, affordability is this growing issue, and yet pricing remains static. And we know that there are dollars in the system. You know, pharmaceutical companies spend upwards of $6 billion annually on traditional drug coupons and vouchers, but these dollars are often at odds with health plans and the healthcare system more broadly, as they'll often steer patients to sort of more expensive medications and drugs when cheaper alternatives exist. So our thought initially was, what if you could take the dollars that pharma is already spending on affordability, but put a payer in the driver's seat around how to deploy them? Simply matching the supply of these dollars to the demand from health plans and patients could fix many of the drug pricing issues that we face. And that's what we've done with Sempre's 2-sided marketplace. So to make this a little bit more tangible, I'll walk you through what we do from end to end. Pharma adds their chronic disease drugs to our platform and allocates us some budget. These are some of the partners that we work with. We then contract with health plans who look at our list of available drugs and select just the ones that they care about. So these are typically drugs that are aligned with their formulary, aligned with their clinical priorities. And by the way, we're totally free for health plans. We charge pharmaceutical companies for our revenue. We then enroll patients in our programs and we engage them via text message over time. So you may get a text like, because you're on time to fill, you'll pay just $10. Usually you pay $20. Next time fill on time and you'll pay just $8. And then seamlessly, wherever you go to fill, that's the price that you get. So these behavioral economics-based discounts combined with the engagement drive significant improvements in adherence and reductions in downstream spend for our partners. I'll highlight the two real innovations of Sempre. The first is the business model. We're the only channel for pharmaceutical dollars that actually has health plans engaged and on board. And then secondly, the patient experience, the dynamic discounts and the SMS experience for patients. To really illustrate what that patient experience is, here are two patients, both of whom had a $25 copay, and you can see their experience side by side. Person on the left filled consistently on time and was able to drive their copay down to $14. Person on the right was somewhat late to fill on their second fill, so they paid slightly more, but then was able to course correct their behavior and drive their copay down again. So really, the ability to sort of earn discounts with adherent behavior drives the very adherent behavior that we're interested in. And patients love this. The nice thing is that we may meet patients where they are, which is on their phones texting. There are no apps to download, no passwords, no accounts. And being in patients' pockets really, I would say, allows us to collect some really nice feedback in real time. So here are some of the things that they've said to us. We've been fortunate enough to continue to serve our patients during the pandemic. There are some features obviously inherent to the program that allow us to do this, like the focus on affordability and accessibility, and the fact that we're engaging patients remotely over SMS. Additionally, we've done some things like partner with at-home medication delivery solutions, help patients transition from 30-day supplies to 90-day supplies of their meds so they have to go into the pharmacy less often, and then taking care of submitting the refills for them at the pharmacies where they usually fill, which is something we've actually recently patented as a technology solution. Really quick, I'll share with you two case studies. The first is from the health plan perspective. We've been live with UPMC Health Plan for over 3 years. They initially started with just one drug, expanded to 4, and then next month, which is Diabetes Awareness Month, they're rolling us out across their entire diabetes portfolio. Nearly 1 in 2 patients has opted into this program at UPMC, and patients save on average like $260 per year. UPMC saw not just an increase in adherence, but also a reduction in downstream medical spend as patients were healthier and then you had to sort of use medical services less. From the pharma side, the program has been just as effective. This is an example of one of our pharma partners, Novo Nordisk, who came on the platform in 2018. They started by adding just one medication, experienced really great ROI on the program, and went on to add their anti-diabetic portfolio on the platform as well. So this is sort of the conclusion here, which is the secret to, I would say, our success has been the flywheel effect. You know, we delight patients by providing discounts to them on medications they really need and care about. This in turn delights the health plan as patients become more adherent, engaged, and cost less. We're also free for the payer. And then this captivates pharma because they obviously benefit economically when patients take their medications, but also because payers are actually asking for this program versus blocking their dollars. So they then invest more dollars onto the platform, which allows us to serve more discounts to patients and so on. And this is our team. There are 25 of us. Ordinarily, we're based in San Francisco, although right now we're all remote, and we have some great investors and advisors. Thank you.
Thanks, Anurati. And thanks also for mentioning that we will have Q&A after all the startups present. So feel free to type questions in to the Q&A section now as they occur to you, and we'll try to moderate them. And Adam and Hubert will also be participating a little more actively in that part of the session. So, so as you think about questions or responses, everybody just type them in the Q&A, and we'll get to that after we hear from the next two. Next up is Wanona Satcher from Mākhers Studio. And Mākhers Studio is using modular technology to design and construct affordable on-demand housing and medical spaces for doctors and marginalized communities. So Wanona, we're ecstatic to have you here today, and can't wait to hear what Mākhers Studio is up to.
Thank you. Can you all hear me?
Yes.
Okay, great. Thanks for having me. Really excited. Let me share my screen. Yeah, so Mākhers Studio, we are headquartered in Atlanta, Georgia. We are a green manufacturing and design build firm. We specialize in utilizing modular technology to build sustainable and green residential, commercial, and of course, pivoting a little bit for COVID, medical real estate. We also develop micro factories, we call factories in a box, so that we can provide what I heard earlier called acute healthcare access so that we can build spaces and people can build the spaces that they need and build on-demand medical clinics in underserved communities, or even if your community isn't, but at least it's an opportunity to build the real estate that you need to have access to the healthcare and services. So we have three major customers and their problems. So physicians don't typically or might not have the access to quality neighborhood medical spaces for the most vulnerable, lack the access to local, walkable, and transit-oriented affordable healthcare. And then, of course, the unemployed, underemployed, which has been exacerbated during COVID, to provide local manufacturing opportunities to increase the opportunity to have jobs and have some savings and funding to get the service, to have the adequate healthcare services that you need. So our solution, MedPods, this is one of our plug-in pods we actually pivoted and quickly prototyped this year to turn into, this summer actually, to turn into a MedPod. And our MedPod is our recycled shipping containers where we utilize modular strategies and technology around creating on-demand spaces for affordable on-demand spaces for both physicians so that they can provide first responders with care, and then also creating the access for affordable healthcare services for patients in marginalized and underserved communities. Our MedPods are built locally, which goes back to our third customer, which are those individuals who need access to jobs. So literally building the change that they need and the change that they want to see when they need it. We realized that a big part of the issue during COVID was accessing PPE and other supplies and services that may have been manufactured other places. Well, now we're looking at how do we create the infrastructure to actually build those services and products that we need for the next pandemic and even in post-COVID. Here's an example of the interior of our MedPod. We work closely with a local, and you see her here, medical physician, first responder, a breast cancer physician here in Atlanta, who helped us look at the functionality of how to design our spaces with mobile technologies that she has. She's a physician in private practice. And actually it's my mom who was there as a model for our prototype. But you can see, and of course we have the Wi-Fi and technological capabilities to plug and play for telemedicine and other testing services needed by the community. This pod is actually located in a small urban site in the backyard to show that you can literally plop and place these down anywhere. And it also provides the access for those patients who don't have access to technology, who don't have access to cell phones, but can walk and bike or take transit to these facilities that are located near them. So it's all about meeting the community where they are. So this is how it works: products, people, pricing, and public policy. So we literally use a material that is in abundance, and we customize them with our patients and our physicians and first responders and healthcare administrators in mind to create scalable and affordable, mass-producible our clinics, our MedPods. And then in doing so, we hire local tradesmen, tradeswomen, veterans, LGBTQ, and minority subcontractors to build these units. With our offsite manufacturing space that we're actually looking to acquire soon, hopefully by the end of the year, we can build 10 to 15 of these pods in less than a month, 20 to 30 pods in a couple of months, and deliver them in less than a week to the community in need. So with physicians, hospital administrations, medical foundations, legal and at the federal and at the state level to provide these pods. From a pricing standpoint, they are highly customizable. But the one that I showed you, we built actually in 22 days by ourselves as a prototype. We crowdfunded and we built it for about 20,000. And so we would probably, a good selling amount would be 45 to 50. But of course, it depends on the need. It depends on the functionality of whatever the physician and patients, what their needs are. This is a question around policy. It's not just healthcare policy and delivery, but it's also around equity, and it's also around land use. And Bambi mentioned earlier, talking about opportunity zones. This is a potential to utilize maybe a not so effective tax credit program to turn it and transition into a very effective tax credit program for not just housing, but also for medical services now that we have COVID. Our accomplishments, sales, we started our company in 2017. As a startup, we just started gaining traction really the beginning of last year. We've built some other pods, affordable housing and commercial spaces, but this was our first MedPod that we prototyped this summer. And we've crowdfunded and raised about $85,000 to $90,000 so far. So our market opportunities, this was taken, we looked at these numbers earlier in the year before, but we're talking not necessarily about federal applications, which you can for our MedPods, but really at the neighborhood level, at the street level, meeting people where they are to build medical spaces that are easier, less costly, more sustainable, and quicker to design and build and to deploy. And the other market opportunities, so that was the market opportunities for our target audience as far as customers. We also have market opportunities as far as our target, the manufacturing, the making of these spaces. This was from McKinsey and Company report. We hit 3 of the major types of types of markets. When you're looking at literally creating these spaces, we're able to ship them overseas because they are shipping containers. And so the opportunity for scalability is really cool, and it's huge. Quickly, our team, this is the core team, our executive team, myself, Kevin Hammock, and Reed Merrill. And we've had some recent press. We were just featured in Inc. magazine. So if you go to Inc., you'll see a little bit more about our story, about how we started and why we're doing what we're doing. And it really is about creating models that facilitate both workforce expansion as well as connecting marginalized communities to both the services that they need to be successful, so that they can create the change or build the change that they want to see and that they need. So, opportunity to,
all right. Thanks so much,
Wanona. Thank you.
And again, folks, use the Q&A for questions that we can field after the next presentation. So thank you, Wanona. And our third and final startup for today is Ejenta. Rachna Dhamija is the founder and CEO of Agenta, and Ejenta is bringing technology that was developed to help people explore outer space to help them now monitor their health at home, and has a pretty cool application on the front lines of the pandemic. So Rachna, take it away when you're ready, please.
Thanks, Ethan. I'm just waiting for my presentation to load. While it's loading, I'll just go ahead and say that, as Ethan mentioned, we're a startup based in San Francisco, and we're helping health providers to remotely monitor patients from home. And we're doing this using technology from NASA. So I'll go ahead and start with the problem that we're solving. So on your left here is Leo. He's a patient with heart failure, has many chronic conditions, and he's isolated at home, and therefore it's hard for him to take care of his conditions on his own. And on the right, we have Dr. Jordan. She's Leo's cardiologist. She's a doctor at Kaiser Permanente, who's one of our customers, and she has to take care of thousands of patients like Leo, and her problem is that 22% of them are readmitted every 30 days. She can't really adequately keep, as close tabs on them as she'd like to while they're at home, and it's a huge cost to the health system. It's a huge cost to the patients themselves, and especially now with the pandemic, she really wants to keep Leo at home, both to limit his exposure to the coronavirus, and then also just to preserve capacity in the hospital and in her clinic. And today her problems have really compounded because now she herself is also at risk. So we know today that 11% of our frontline healthcare providers are diagnosed with COVID-19. So our solution, we're applying technology that my co-founder developed at NASA for remotely monitoring astronauts in space. And the unique feature of our technology is something called intelligent agents, which are essentially software programs. They're autonomous. They continuously monitor the astronaut by capturing data from the astronaut spacesuit. And then they create predictive analytics, which they share with the people in mission control who are taking care of the astronaut. And now we're applying the same technology to patients on Earth. And so just to give you a sense of how it works in one use case, in April of this year, right when the pandemic started, Kaiser Permanente, who's one of our customers, asked us if we would help them to monitor their ER and ICU clinicians who have a lot of exposure to the coronavirus. And so the way our system works is we're device agnostic, but in this case, we give providers a small wearable sensor patch, which is about the size of a Band-Aid, which they strap on their chest. And it continuously collects their temperature, their respiration rate, their heart rate. We can detect coughing, we can detect their activity, and we can continuously monitor them while they're at work, while they're at home. And this data is then sent to our software platform where there's one intelligent agent per person that's being monitored. And we create a personalized and predictive model for each person that we're monitoring. So we create predictive analytics, for example, detecting a new onset of COVID-19 symptoms, and send those analytics continuously to a dashboard where the population can be monitored. If we do detect something, the intelligent agents will autonomously jump into action and take action, whether it's to contact the person who's being monitored, maybe to ask them to fill out a survey or to give them education or to collect follow-up symptoms or to tell them where to get a COVID-19 test, et cetera. And so, other use cases that we have are for patients with chronic conditions where we're monitoring patients at home. And it works similarly where the health provider will give the patient, depending on their disease condition, a kit of devices so that they can monitor them remotely. So for a diabetic patient, it might be a blood glucose monitor. For a hypertensive patient, it may be a blood pressure monitor, weight scales, activity monitors, you name it. We've been able to collect the data into our system, and we create a predictive model for each patient, alert the care team when we think that a patient has a high risk for readmission or is deteriorating and needs help. And then we engage with the patient directly through mobile phone applications. And now today, we've added support for Amazon Alexa. So the patient can say, how am I doing? Or a caregiver who's taking care of a patient, for example, you could say, how is dad doing? Did dad leave the home? How's dad's blood pressure doing, et cetera. And Alexa will respond with feedback to keep the whole care team in the loop. And then we send the clinical analytics to the care team in the clinic or the hospital. And instead of overwhelming the clinicians with a lot of data because they don't want more data, we give them a really simplified view of how their patients are doing and early predictive knowledge of how their patients are doing so they know who to reach out to and who needs their help. A couple of results from some of the work that we've been doing with various use cases. These are results from controlled clinical trials. So working with a health provider in Arkansas where we monitored their Medicare frequent flyers. These are patients who are in and out of the hospital. We demonstrated an 85% reduction in 30-day hospital readmissions. So this was a huge positive result. In working with Kaiser Permanente to monitor their heart failure patients, we demonstrated a 56% reduction in 6-month cardiac readmission. So we were able to show that even over time, we're able to keep those readmissions down over the course of 6 months. And in working with high-risk pregnancy patients, we demonstrated that women on our platform have a 55% chance less of developing adverse outcomes. So women had less gestational diabetes, less preterm births, less need for C-sections, et cetera. So I think that I will stop there. I think I've gone to my 4 minutes, but I'm happy to take more questions and go into more details during the Q&A session.
Thank you, Rachna and Anurati and Wanona. I think we've had maybe 1 or 2 questions in the chat, but Hubert from Health Wildcatters, who is one of our, I think also raised his hand and said he had a question maybe for one or potentially for all of you. Hubert?
Yeah, thank you. Thanks. Hi everyone. I was gonna ask Wanona about your pods. I see the vision. It's a really cool idea. Can you expand a little bit on where you see most of the traction? Where you, I mean, there's so many ways you can go about this. There's also a really cool company called Shelterbox, which I want to make sure you know about. I know the guy that runs it, so if you want to get connected to him. But anyway, I just was feeling they just deliver like materials to emergency areas. But I feel like your solution could be, it should be something that they also ship. So.
Yeah, I appreciate that connection. I have heard of them. Yeah, I mean, our pods are so versatile and highly customizable and scalable. We started out from an impact standpoint of building for affordable housing to help with housing affordability and to create spaces, affordable spaces for small businesses, for entrepreneurs who were trying to figure out how to build capacity without having a brick and mortar. So it was housing and it was also workforce and economic development. And then COVID hit, And we realized that our spaces could also be utilized and leveraged as affordable healthcare spaces. And we met Dr. Spencer, who fell in love with the idea of having a space that she can meet individuals where they are with the pods. And so COVID, of course, exacerbated both areas. It exacerbated the homelessness crisis, and it also, of course, exacerbated and really put a light on the challenges that we have with our medical system in both health and wellness. So it's almost a simultaneous traction challenge, which is a good challenge for us to be able to provide both housing, but also affordable pods for medical and key community anchor services.
Thanks, Wanona.
Okay.
I saw a question. I saw a question in the chat that I think might have been aimed towards Anurati, because it came around the Sempre Health presentation, and it was. And again, maybe it wasn't aimed there, but Anurati, I think maybe it'd be interesting to hear your perspective on applying your tech. It says, do you work with Medicaid population or vulnerable populations with their product? And I think maybe the broader question is, are there ways to take what you're doing now in kind of commercial and expand that and actually kind of take these learnings and these incentives that lead to better adherence in programs like Medicaid?
Sure, yeah. So at the moment, we don't work with Medicaid or Medicare. There are restrictions around pharmaceutical dollars subsidizing the out-of-pocket costs for any federally funded patient. So we are exclusively working with commercially insured patients today. That said, we have partnered with a health plan, a large Medicare plan in Florida, where they will be actually subsidizing the copays with their own dollars. And in fact, the Centers for Medicare and Medicaid Innovation, CMMI, host frequent demonstrations where they would actually supply the pool of dollars to actually subsidize copays. So those are two things that are in flight and certainly would increase the patient footprint for Sempre as well.
Great, thank you. And Rachna, I see a question here in the chat. How do you see surviving and scaling at this time when, well, I'm not sure if I quite get the question. How do you see surviving and scaling at this time when Livongo like big players? So I guess maybe it's a sort of, how do you exist when there are some kind of what we used to think of as maybe startups that are breaking out and achieving scale? And what does that mean for for business like yours, competing kind of maybe what seems to be kind of generally in that same space?
Yeah, there is a lot of competition in the space, certainly. I think remote monitoring is where telehealth was a few years ago, where it's definitely the next thing. And, the providers that we're working with, we were once considered to be a future thing that would evolve, and with small pilots, and now all of our small pilots have turned into really large deployments. So providers are kind of jumping into the deep end, and they realize this is the only way now that they can, the future is here, and this is the only way they can really monitor their patients. So there is a lot of competition. There is also a lot of reimbursement that's available. Speaking about reimbursement from Medicare, for example, that's been growing since 2018 for this technology. So I think Livongo has a different approach than we have. Where they're providing a service, we're kind of more of a tool where we focus on the analytics and the AI and creating a personalized machine learning model. So our approaches can coexist with other types of companies as well. So you're going to see a lot of consolidation in the market. And this is definitely the future, and we're just excited, to have been an early player in the space. So we're pretty excited.
Hey, Ethan, I have a few questions and comments, if you don't mind me jumping in here.
Yeah, hey, I was just messaging with you. This is Adam speaking from Material Impact.
Yeah, hi. First of all, just a quick comment, Anurati, Rachna, and Wanona. Just first of all, fantastic technologies that you're all working on, and congratulations on all the progress that you're making. So really great to see. Maybe I'll just have start my first question with you, Anurati. Really love what you're doing, and I think it's actually very well positioned and timed today. How do you foresee your constant collection of health economic data / cost effectiveness data to try to quantify, some economic value proposition so that you can expand your programs within a pharmaceutical company to expand to more drugs or through the payers. How are you collecting that data to substantiate that?
Yeah, so Sempre actually delivers the discount at the point of sale. So part of our technology is that we are connected to the US retail pharmacy network. And so we're actually a payer on the claim. And that means that in real time, we know when a person has picked up their prescription and we're actually administering that incremental discount. So for example, if you have a $50 copay, Walgreens might ping your health plan. They'll say, okay, your copay is $50. At that point, they ping us and we say, okay, you're on time, so we'll cover another $30 of that. And you see the final price of $20. As a result, we get that real-time notification that you're picking up your prescription, what you would have paid without us, what the discount was that we delivered, what pharmacy you're at. We have a lot of data around that. And so we're able to stitch together kind of your longitudinal fill history and demonstrate that against a control group, we actually kept you on therapy longer and spent fewer dollars as compared to a traditional pharma coupon to do so. And then because we're free for health plans, we actually negotiate some pretty great data rights with our health plan partners. And so they give us, your benefit design, they give us your eligibility claims, and they give us your medical claims. So we're able to even go a step further and say, not only did I make you more adherent, but that as a result kept you out of the hospital and you cost your health plan less. So that allows us to sort of, construct that ROI story on both the pharma side and the payer side, where it's actually kind of a misnomer. There's not really an investment on the payer side. It's all kind of upside for them.
I mean, that would be fantastic if you can go beyond medication possession ratio and actually start looking at indicators of outcome or indicators of, minimizing progression. That would be phenomenal.
Yeah. And we're, a lot of pharmaceutical companies and health plans are already negotiating value-based contracts and risk-based deals where, the payer pays less essentially if the drug doesn't work. But you can't study if a drug works if no one's taking it. And so Sempre has really been built into a lot of those contracts to ensure some level of baseline adherence so that you can actually have some more of these risk-based contracts take place.
Great, and maybe a quick question as well for Wanona. Wanona, I first of all, I got to tell you, I love your vision and your focus on diversity, and I love what you're doing. How do you foresee your ability to grow this business towards the aspirations that you have in a way where you become, we can scale it and become less dependent on having to subcontract, typical things like permitting and HVAC and so forth, where then it may dilute your focus or your scope?
Yeah, good question. So there's a couple of ways. Right now, we are actually in the middle of, almost past the middle of raising our next round of funding to acquire our first, what we call factory in a box, a pilot, a neighborhood manufacturing facility, small footprint, to be able to scale the outcomes, these met pods and affordable housing pods. And so it brings our cost down to build per square foot, it brings the unit cost down, and we could deliver more quicker. With that approach, we intend on then essentially shipping our factory in a box to other underserved, marginalized communities across the country, where we would help program kind of like a franchise model, if you will, of manufacturing these pods and working with local tradesmen and women there. So that is really our 1 to 3 year mapping for scalability. And then of course we can ship our factory in a boxes and pods overseas for global support. I will say though, we are also looking at the next phase, which is leveraging bio and nanotechnology of how we can set up build with metal and steel to actually growing it and looking at zero waste sustainability options. We could actually look at, instead of paying subcontractors, we can actually utilize more scientific methods of building materials and products that are more sustainable, but we can actually build them stronger and build them locally. So it really is a supply chain conversation around not just building these pods as outcomes to service needs of the community, but it's also how do we build better, and how can we mobilize these products in a way that's that's more cost effective, more cost competitive, and more technologically advanced. So that's really a short-term and long-term business model that we are working towards right now.
Thank you.
Okay, well, I think we are we're at time on the Q&A, but it should be easy for folks to reach out to Wanona, Rachna, or Anurati if you need to or would like to follow up. Bambi and crew, are you there? You ready for the instructions for what happens next?
Yes, we are back. Bambi, I think you're on mute. And
I am. Yeah. I feel like what is that? The Penguin movie when the octopus is I always feel like that. I can't operate the video. But I did want. Hubert, did you have any other thoughts? Because I know you had one question, but don't want to let you go.
I think we're good. I mean, Adam made some good points. I think we got them covered on questions. Thank you, though.
I have one question for Sempre Health, though. You're addressing all players in the pharma journey, but you're missing providers in your solution. How are you addressing that? Because the prescription really comes from the provider. How are you influencing that?
Oh, actually, we make it a point not to influence the prescribing decision. And we don't want to, I think there are many reasons a person may get prescribed a drug, and we just want to ensure people can afford it and continue to take it once that's the clinically appropriate decision.
So your journey starts after the prescription is written.
Correct. Yeah.
Okay.
Yeah.
Thank you.
Okay.
All right.
Thanks again, everybody, for presenting and sharing what you're working on. Really interesting and powerful stuff.
Thank
Thank
you.
you.
Thanks.
Thank you. All right. So